And we are back on Medical Monday. I'm Chuck Long here with Dr. Carrie Gannon. We are talking about foot problems. And as we've said all through the show, and you see this every day, people have a lot of foot problems. I mean, do you have, like, as far as the body, is it just because we use our feet so much? I mean,
well, I mean, if your feet hurt and you can't walk, you can't work, you can't work, you can't eat. So it really brings them in. And we buy the wrong shoes, we buy the wrong size shoes, and we're working really hard. You know, we're constantly on our feet. So
well, and there's so many things, and like I said, when I was getting ready for the show this evening, I just started thinking about, I was like, oh, I was looking at some of the topics. I'm like, oh, yep, I've had that. Oh, yep, I've had that. And I was thinking of all my friends. And, you know, when I first had plantar fasciitis, I can't tell you how many people, everybody was saying, oh, and then they were recommending what to do and that sort of thing. So let's just kind of start, if somebody just happens to be tuning in right now. Plantar fasciitis, very, very common. So basically, what is it, what causes it, and how can you treat it?
The plantar fascial ligament is a very thick, strong ligament on the bottom of the foot. It originates right in the center of the heel bone where you feel the pain. Over time, it doesn't stretch like it used to, and it's not as supportive as it used to be. So instead of stretching every time you step down on it, it will sort of pull and rip and tear right at its weakest point, right where it originates on the heel bone. At first, you know, you'll take a few steps and it'll feel better, and it'll kind of trick you. You'll think, oh, I'm getting better, and then the next day it might be okay, and then the next day it might start again. But over time, that inflammatory process progresses, and it becomes all the time.
Right. So, but there are things that you can do to alleviate the pain, to help it, which I love. So we are going back to the lines right now, and by the way, if you do have a question or comment, we encourage you to make sure you get in line with us here on Medical Monday. There's the number on your screen, 615-737-7587. We go back to the lines right now. Thomas is on the line with us. Thomas, we're glad you're joining us here on Medical Monday. Do you have a question or a comment for Dr. Gannon?
Thank you. Yeah, I'd like to ask the doctor about a toenail.
Okay. Go ahead.
About 2 years ago, I mashed one of my big toes, and of course the nail went dead. And can you hear me?
Yes, we can.
Yes.
Okay. It turned black and everything, you know. It finally, about 6 months ago, it finally grew back out to normal, but it keeps rolling down and rolling back under it. And of course, that makes my toe sore.
Sure.
Will that ever stop doing that, or do you know?
Bad news, Thomas. It sounds like you might have damaged the nail bed. When you damage the nail bed, that's permanent in nature, and every time that nail grows, it's probably going to grow back thick and rolled under like you're describing. We can do what's called a debridement for you. We can cut it back, keep it thinned out so that you're more comfortable and not in pain. But unfortunately, when you have an injury like you're describing, where the toenail has fallen off because of damage, the nail bed itself, which is the part of the toenail, the toe that forms the nail bed has been damaged, and it's probably always going to grow back like that. We can do things to keep you comfortable, but we won't ever be able to give you the same nail back.
Okay. Well, again, good to know that. So, and I know that's tough. One of the things I think a lot of people think when they're feeling like they have some kind of problem with a foot, with a toenail, that area, you know, when you're walking, is what you're wearing, where you find the right shoes and that kind of thing, the right inserts. We were talking a little bit about that earlier. So what do you advise people to do when they come in and they say, you know, I'm having problems, my foot's sore? Is it arthritis? Is it, you know, what should I do about it?
Well, certainly after we evaluate, sometimes there's things that shoe gear changes won't help. But I will tell you, a lot of times just changing the shoe gear is really, really beneficial. A shoe that fits adequately, as we described earlier, is very, very important. There's a lot of great stores in this area that take a lot of time and will actually spend the time to measure you for the right shoe versus just sort of throwing shoes at you when you walk by. You know, New Balance in the area does a really good job. David Parker Shoes in Cool Springs Galleria, his store does a great job. Good Feet store, you know, people tend to do very well there as well.
Okay, and some of it too. I mean, I just wanted to go over some of these items as far as what you can do to kind of better, so that you're not in a situation where I go, oh, I've got this problem, I've got that problem. What about wearing shower shoes or flip-flops around public pools, locker rooms, and showers?
You're not going to be able to eradicate or protect yourself from all bacteria by doing that. It may be from a hygienic perspective or a cleanliness perspective. It's not a bad idea, but we are covered in bacteria. We're covered in yeast and mold and fungus, and if it's going to grow on us, it's probably from our own bacteria.
Okay. What about this one? Change your shoes and your socks often.
Yes. I find that people tend to wear the same shoe for years at a time, and our feet change in shape and size over time. Shoes denature over time and don't fit you adequately. So it's always a good idea to change them out.
And is there a particular way that you should keep your shoes clean? I mean, literally, I mean, some people say, well, just spray Lysol or something on your shoes, something like that starts killing some of the germs, bacteria that might be in your shoes.
You can do that. That's not necessarily curative either, because again, we are covered in the bacteria and all those microbes. You can cut it down by always wearing socks, wearing cotton socks or wool natural fiber socks. We do something called Shoe Shield, which is very similar to the Lysol that you can spray in the shoes, but that's not curative. It's not going to prevent you from getting fungus or all kinds of infection. It may just lower the count in your shoes.
Now, and that was one of my questions too about using the right footwear. The kind of socks that you get,
sure.
there are certain socks, and you were saying like synthetic fiber. Are those some of the better materials that you can use?
Usually synthetic fibers, or all synthetic fiber socks, are not the best for you. It's usually more of a natural fiber sock, like your cotton or your wool. Obviously, there's going to be some synthetic in there, but the predominance of the natural fiber is far better for your foot.
Okay. Then we're talking about toenails, and I know a lot of people have had ingrown toenails
Sure.
and that sort of thing. What about trimming your toenails? What's your advice there?
Again, there's no perfect way to do it for everyone to prevent ingrown toenails. Straight across works for some people, down in the corners works for some people. What I will tell you about ingrown toenails is one of the #1 causes I see that cause it are shoes that are too small, and then people that pick at their ingrown toenails. Now, I'm a picker. If I had something on me, I would be picking it, so I'm not in any way
judging.
Right, I'm not judging. I would be like, what is that? Let me do it.
Right.
But if you pick at it, you frequently cause little injury to the skin, and it will worsen the ingrown toenail. And the other thing is no hydrogen peroxide. Hydrogen peroxide is terrible for skin, okay? It does not bubble out infection. It actually starts to damage some of the tissue, will make it more red and drain more. So when you're dealing with an ingrown toenail, Epsom salt soaks are better, betadine is better, saline solution is better, no hydrogen peroxide.
Another great fact to know. What about foot powder? Should you use that?
I love foot powder. It helps control moisture. Moisture is the environment that helps the fungus and yeast and mold and bacteria grow. So if we can keep the moisture under better control, we'll certainly help ourselves in that regard. So if daily foot powder in between the toes or in the shoes, I mean, even baby powder is fine.
And then what about the utensils that you use to trim your toenails or that sort of thing? You know, some you get the clippers, some you have the cuticle clippers, that sort of thing. Kind of, and should you keep those? I would think it's common sense, but keep those clean kind of thing.
You do want to keep them clean. The biggest problem that I see with those devices that you can buy over the counter are are not accommodating to the larger, thicker toenail. They simply will not cut through them and can't get around them. And I will have people come in, they're trying, plant pruners, garden shears just to get around their toenails. Don't do it. Come see us. We can take care of the toenails for you when they get that thick, because a lot of times those little nail trippers and stuff, they just aren't going to work for you.
I'm so glad to hear that, because I mean, people think, I've got to do this.
Sure.
But yeah, just go see you. What about the nail polish that some people just insist upon using? Is it good? Does it keep your toenails stronger? I know obviously it makes them look pretty, but
sure. Nail polish is kind of a mixed bag. It's not possible to make nail polish completely chemical free. It's not possible to live life without chemistry, but nail polish in particular, there are some polishes that are better for you than others. Nail polish with formaldehyde resin, camphor, DBT, toluene, TPHP, all of those things are very damaging, not only to the health of the nail, but also to the body systemically. Gel nails are very bad for the nail. Acrylic nails are very bad for the nails. We like everyone to always use a base coat. The base coat for the nail polish is not a shiny coat. It is something that adheres to the nail on one side, it adheres to the nail polish on the other side. A couple of coats of some healthier nail lacquer. Usually you're looking for a 5-free or an 8-free product, and then a top coat will really help kind of seal the nail in. But any nail polish that eliminates a lot of those chemicals is healthy for you. There's not any nail polish that is 100% curative or 100% chemical free. It just doesn't work that way.
Okay, very good to know. We're going to take a break. When we come back, we're going to tell you how you can get in touch with Dr. Carrie Gannon, so come on back with us.